So the first one, and the first and foremost orthopedic condition that usually comes in Nagandhaja is trauma. Abhigadaja. In Ayurveda we call it. Now, Abhigadaja conditions, yes, we know Acharya has divided it beautifully as Kandapagna and Sandip Mukta. Now, in that, what all conditions we can take and what all we need to avoid. If to explain, the thumb rule which I usually take is the fractures or the bhagna, khanda bhagna, that ever happens with an articular involvement or an articular surface involvement, better we avoid. More than like multitude of fragments are there, then also fracture with more than 3 fragments happening, like a T fracture, Y fracture or something like that, or a total bone fracture. In such condition, or we call the complete fracture, in such cases also, preferably avoid it if the patient is in young ages. But there are situations where people are apprehensive of surgeries. They don't want to undergo surgical condition, especially elderly person. While I was studying in Trivandrum Government College, many of the cases that came in were age-related fractures that came in. People doesn't want to go for surgical, even though we advise them to go. They want a conservative management. And in such cases, yes, you can manage by stating all the complications that might happen to the patient and take the case with a high risk. We have to weigh the high risk part in that coming up. Now, trauma as said, but not all traumas happen or fractures happens is of complication. So it's easier, we can judge on that part. Always have an X-ray, take an X-ray, find it, and remember the anatomical variations that can happen if suppose certain sites are common fractures that are common for nerve injuries. In such cases, please avoid such cases. And have a proper orthopedic surgeon only. Do it in a better way. So that will be for the mobility of the patient also, it will be much better. And the recovery also will be much faster with the newer techniques in orthopedic management. But other conditions where maybe 70% or 60% of the fractures that happens are usually which is easily manageable. It might be a very simple fracture. In such cases, yes, Ayurvedic management works wonderful if the patient is willing and cooperative. That's important.